Hello, good afternoon. We hope we have you here with us on this new link. We apologize for some technical difficulties. We found out that half could hear us and see us and half could not. So we hope you've been able to make the jump. If you are here with us today, just to let us know that that's true, if you could give us some feedback. Thank you, Jan. Good to see you here. We're just going to wait a minute or two as we allow people to transition over to the new hyperlink.
Okay, folks, well, let's try this again. I need a little extra practice this morning or this afternoon anyway. So, well, welcome to today's webinar titled Powerful Story and Case Study. The presentation is a continuation of our webinar series highlighting Leeway's grant project and the co-creation of a community living model. I am Heidi Gill, president of HoodenPyleGil, known as HPG, and the lead coach for the Leeway project. And with me today are two other members of HPG and the Leeway project team, Dahlia Mannon, our research fellow, and a critical member behind the scenes of our webinar is Melissa Cox, our project's community liaison. Also, we've been very lucky to have an important team member from the community with us today, Diane Watkins. Diane has been an active member of our Wisdom Council, and we are fortunate to have her leadership and voice in our presentation today and each day she spends with us. We have over 70 participants registered today who we hope and wish we could see you right in front of us, but we're glad you're here and we thank you. We have people from a nice cross-sector of stakeholder groups, including community members and local, state, and national leaders. Again, thank you for your interest. We look forward to your questions, which can be typed in the right-hand corner of your screen. We will track these questions through our presentation, and we'll answer them during the Q&A session at the end. The two-part series represents the release of the second chapter of our Living Storybook. The Living Storybook is an unfolding story of community working together to co-create a community living model. Chapter 2 is primarily an evaluation of data, strengths, needs, and opportunities as they relate to the building of this model in the city of New Haven. Chapter 2 will be sent out to the webinar participants this afternoon. Hooray, we can't wait for you to get it. And if you have not received the first chapter with the introduction to the Leeway project, please let us know, and we will send that along to you as well. So today's webinar will start with an introduction that will level set everyone's knowledge. We will next review our guiding principles referred to as powers, and we will end with highlighting case studies and practices that are aligned with these powers. So let's start. So by way of introduction, this project has been funded by DSS under the Nursing Home Diversification Grant Program. Aimed at increasing informed choice to live in community, we are trying to increase and improve the access and awareness to long-term care services and supports. And to that end, our aim is to create a community living model. So why a community living model, and what is the compelling reason? The community living model will encompass a systematic care coordination infrastructure through places of dynamic services, or what we refer to as pods. In this graphic, you will see examples of the types of pods that will be joined together to deepen program collaboration and solve for the time in between medical interventions with a sharpened focus on the social determinants of change. The community living model will also address the need for service integration. And through the development of a place of well-being, or POW, medical and social supports will be provided with seamless access and services under one roof. Together, the POW and the pods are a hub and spoke infrastructure that will assist with transforming how long-term care service and supports are accessed and experienced, with this ultimate desired outcome to lower costs while increasing choice and quality of life for the residents of New Haven. Today, we'll focus on how the guiding principles will be foundational to building this very important community living model. During part 1 of the webinar series, we also covered the content of this entire placemat, which comprehensively describes the process for visioning and implementing the community living model. Please do not struggle to read this, but plan to listen to the webinar that has been taped for a full explanation. You can find this placement also in the Living Storybook. So for today, if you look in the middle, we'll be focusing on what we refer to as the powers or the core of this project. We believe that these powers are the guiding principles, and I think you will agree that central to community engagement and transformation is the discovery and the alignment to guiding principles. So next, Dalia Mannon will review our qualitative findings and how the themes heard from community voices like Diane have been transformed to the guiding principles for our project. Along her side is Diane, who will speak to how these powers resonate and have inspired her. Dalia and Diane, take it away.
Thank you, Heidi, and just want to say hello to everybody out there. I'm watching the number climb, so I really appreciate your dexterity in jumping over to this webinar and making it happen today. Yesterday, we reviewed the powers and their components in depth. The 8 powers represent the core values and guiding principles that emerged from our qualitative methodology. If you were unable to join us yesterday, the definition of the powers, their components, and why they are crucial to the community living model is written about in Chapter 2 of the Living Storybook. Very briefly on our method, we have adopted a strengths-based philosophy, knowing that we will achieve much more by building upon what works than we will by trying to shrink our gaps. With this in mind, our method to interviews and focus groups was appreciative inquiry, where we explored and discovered the strengths, successes, and potential of the best of New Haven. Today, though, we have a very special treat. We will add colors to the powers by sharing some of the quotes that we heard in our interviews, as well as hearing the personal account and life experiences of a passionate and committed community member and team member, Diane, and how the powers have supported her to thrive and flourish. The first power is dignity, which at its core represents recognition and respect. Dignity is central to the way we interact with each other, particularly in a medical model of wraparound care delivery. A powerful quote that speaks to dignity is the following: "I always say when I look at you, I see me. When I look at someone in a bed, I see me. A wheelchair, we forget how fragile we are. We all are not perfect. We all are made from the same type of mold." This quote speaks to the fact that no matter who we are and what our circumstances are, fundamentally, we are all human and share in this together. On dignity, Diane is going to share with us how crucial respect is and how recognition enables safety.
Yeah, I'd like to share experience that when I was hospitalized, the nurse at the hospital treated me with respect. They would explain everything they did. We were going to administer medication and everything to me, so I knew what they were doing. Also, when they would go out and order their lunches or dinner, they would include me in that, come in here and ask me, did I want anything? So I felt that made me feel really well.
Mm-hmm. The second power is that of positivity, which encompasses hope, optimism, self-esteem, and purpose, and reveals their importance in working with individuals to achieve person-directed goals. Here, we heard a community case manager tell us, "I tend to be a little bit more on the positive side. I try to do the motivational interviewing aspect of it so that I'm only focusing on the positive. The more you focus on the negative, that's just going to keep your attitude down and everything's going to be on the negative. You're not going to see that little glimmer of hope, that light, the one little thing that can turn around might be that change. In this quote, we hear so strongly the power of positivity and how this view of the world propels us forward. Like this quote, Diane has been a source of hope by helping and supporting her friend Michael. She's going to tell us about what it means to her when she observes him succeed at his goals.
Yeah, my friend Michael, he has a chronic illness, and he has difficulty attending his medical appointments and going to places and just to get help. So I would speak to him on a daily basis, and when he do go, I tell him, Michael, that was good, that was great. And it makes me feel good, it makes him feel good, so the next day he's motivated to do something else.
Positivity feeds off of itself.
Yes.
The third power is that of the self. Yesterday, we acknowledged that while there is only so much you can do for another, to heal, an individual has to want to heal and to have a stake in that process. On the importance of doing with and not for, we heard one caregiver say, the one day came from a long process. An individual was talking to me and said, I'm just really proud of myself. And I said, oh, that's wonderful. What in particular is making you feel so proud? And she said, when I first met you, I couldn't ride the bus. I didn't go outside. I didn't walk really anywhere. I was involved in all of these dysfunctional relationships. And now I'm putting myself first and I'm making these strides. And now she can ride the bus. It didn't happen overnight, and now she walks. She had a physical disability due to her HIV and barely walked at all. And she's just up and about and all around and actually has the greatest struggles, yet is the most determined. The individual who spoke this quote is speaking of the accountability and empowerment of the woman she helped advancement. She made it happen through the power of herself. Echoing the story, one of my most favorite stories of Diane's is the next one, which includes her grandkids and her method of goal setting and keeping to pay bills.
My granddaughter would come over, and I wasn't able to even walk very long distance, wouldn't be able to walk a block. But each day she came over, we would walk 1 block. The store was three blocks away from my house. We would walk 1 block and then stop and wait. And then the next block, so forth, so forth. But as we continued to go to the store, the next time we went, I could walk 2 blocks. The next time I was able to walk 3 blocks. Now I'm able today to walk all the way to the store without even stopping. And with the bill paying, I set up so that I pay my bills on the 3rd. I jot down each thing that I'm gonna do, each bill that needs to be paid. And I follow that list. And I always do it on the 3rd. So now that become a practice. So all my bills are able to be paid. I'm conditioned to do that.
Mm-hmm.
So.
Mm-hmm. The fourth power is that of give and receive, which speaks to the success and meaning that comes from a ring of reciprocity. Said simply in a quote by a provider of food and nutrition. And I always love that we really give people an opportunity to get involved in the community in a really important way. Our volunteers will tell you that it's one of the more rewarding things that they do because you're bringing people food. They're so happy to see you. They're so grateful. It's really a mutually lovely thing. For this individual and the volunteers of her organization, the process of giving to others is a gift to her. Diane speaks powerfully to this when she speaks of what giving means to her.
For example, the experience I have with give and receive, my grandkid's mother decided to go to school in the evening. And that benefited me because she asked me to babysit, take care of the kids in the evening. I would, by me doing that, I felt, makes me feel so good and gave me a purpose I felt needed. So I was benefiting more than she was benefiting having me as the babysitter.
Mm-hmm. The fifth power is care and the essentialness of having trust, compassion, and a person-centered focus to wrap around model of care. One individual said, I've had times where I've been able to really engage and have people open up about themselves and trust me with telling their story to me. Helps them feel like they are not alone, and it helps them stay well. Everybody needs connections and people in their lives they can trust and open up to. Just laughing and having fun gives them a purpose. Trust is central to care. Through trust, we open up and reveal our full stories so that the care we receive is as comprehensive as possible. Done in a compassionate way that recognizes each individual as his or her own person, we direct care meaningfully. Being surrounded by those she trusts and who have been compassionate in her care, Diane speaks to the power of family, friends, and peers, in addition to medical providers providing care.
Yeah, I was bedridden long term. I was homebound, and I needed nursing care and everything. The nurses would schedule to come out there 2-3 times a day to give me my meds, clean my wounds and everything. I was fortunate to have my mother and my uncle and my sister to come. They rotated coming. My mother would come from her lunch break just to clean my wounds when the nurse wasn't there. So I had somebody with me all the time, and it means so much to me.
Mm-hmm. The sixth power is that of collaboration, which enables us to broaden and build the strengths of the community in intentional ways. When speaking about how working together supports a shared goal of the individual we are serving, one community case manager said, we've got to keep in contact more with the community because this is, it's holding hands. It's a chain reaction. We help each other. We're all in the same family. I don't mind helping anybody, you know what I mean? But, we've got to help each other. So to make it easy for the patient, especially for the difficult ones, because if we don't keep our eye on them, they'll go back to drugs, they'll go back to alcohol. Shared goals bring us together around the table to collectively solve for sticky problems. They allow us to break down organizational constraints and silos so that together we are greater than the sum of our parts. Diane has a story of this in action. She has had the same doctor for a remarkable number of years, which she will tell you, and this doctor being the hub of her care has been invaluable.
I had my PC, my primary care doctor, for 28 years, and I trust her so much. And then I have other providers, and I will not allow anybody to do anything to me without her knowledge. For example, my eye doctor prescribed fish oil, and another doctor wanted to discontinue it. But my primary would be saying, why did they discontinue that? Because I needed that for my eyesight. So for me, for anybody to touch me, prescribe anything, she has to know. And I have to talk to her. I would call for anything. And even when I go to ER, notify her. So I always trust her, I'm able to talk to her. And that's important to me. It's very, very important to me.
The seventh power is that of community, which reflects how caring for and needing each other is central to the community in New Haven. On this, somebody said, well, community means common unity, a common shared floor, common shared direction. And when you say community in New Haven, that means togetherness. That means proactive movement towards common goals. I find this quote so powerful and such a reflection of the way that the community members of this city think of New Haven. Being a part of community requires access and awareness to the programs, services, and supports that exist and are available. Diane is going to tell us about how crucial this is.
I just recently moved into a small residential complex, and I wasn't familiar with a lot of things that went on there. For example, that had the food bank comes there every Friday at the end of the month, which I lived there for 5 months and I did not know about it. I met one of the residents there, so she shared that information with me. And they posted on the elevator, but the elevator was not in my sight going to my apartment. So I did not know about this thing. So that was very, very important to me.
The final power is that of place, which has a double meaning, representing the dream of a place of well-being, or POW as we refer to it, where all long-term services and supports may exist under one roof in a healing environment. It also means this place, New Haven, and our possibility to together put New Haven on the map as a city of well-being. On the dream of a POW, one healthcare provider remarked, "To put it under one roof, it makes it easier for compliance. It makes it easier for tracking. It seems to produce better results because the clients are happier, right? Because it's easier for them to get what they need." Diane's story of this power is her dream of a healing environment. There are many more of these dreams in the Living Storybook, Chapter 2.
A place where I could go and get medical treatment, find out information, just everything that you need was very important because it'd be easier for me because of transportation. I get to know the staff, you get familiar, you feel comfortable, you start trusting, so you're more likely to keep your appointments and have a better life. I mean, it's accessible to you. It's very crucial, not just to me, to many people in my community.
Mm-hmm. The Wisdom Council grounds the project with grassroots efforts and meets monthly. It provides a platform for those who have multiple chronic illnesses to have a voice and leadership in this change. The final story Diane is going to share with us is what being a part of the Wisdom Council has meant to her.
It's very important to me. It gave me a purpose, a voice. I just feel like I'm being heard. I smile. It impacted me so much. I look forward going to these meetings, and it's incredibly, it means a lot to me.
And it means a lot to us too, Diane, to have you. I'd like to sincerely thank Diane for her ongoing participation and support, and for sharing her experiences with us today. Just so y'all know, we're all getting emotional. This project's so powerful to us, and it's so meaningful to have Diane with us here today. To wrap up the powers, I'd like to revisit a diagram we reviewed. Well, the diagram's not there, but that we reviewed yesterday, and just mention that the powers are infused in every level, from 2 ideas to the individual, to 2 people, to a team of teams, to the community, and to the city of New Haven. As such, the powers are the lifeblood of the systematic change we are aiming to achieve in collaboration with all partners, neighborhoods, and community members.
Thank you, Delia and Diane. What an inspiration you both are. And we thank you so much for this important voice that you bring to our work, and the inspiration that you bring to our work. So we hope to continue to inspire you through some amazing case studies that are linked to each one of these powers, and help us see how we can intentionally use the powers to drive practice and innovation. We also have a few questions that we hope you will help us ponder, because asking like questions often leads to some of the best solutions. So let's begin with the power of dignity. We want to talk about Atlantic City. Atlantic Care in Atlantic City, New Jersey, caters to individuals with exceptionally high medical expenses. The lessons learned from this case study include how AtlantaCare recruited and trained top-notch bilingual coaches from their patients' communities with a deep understanding of their neighborhood, the lived experiences, and the knowledge of how to best access and gather information and formal supports. There is unlimited open access to clinics with supports for evening and weekends, meeting the needs when the crisis arises and ensuring the door is always open. High-touch customer service is a priority, with doctors incentivized to change the care experience. And finally, relentless sensitivity is given to meeting people where they're at. The significant drop in cost of care suggests that practices aligned with dignity are not just a good thing to do, but really show a solid business case. So the questions we begin to ask ourselves when supporting dignity and meeting people where they're at are, how can sensitive training become essential to being in the moment, increasing our ability to come from a place of curiosity without judgment, and deeply change our approach to care? How can pods meet individuals where they are and collectively support issues like transportation, as Diane said, and issues like childcare, like Diane obviously was so good in helping her family with? And how can the answer ultimately be yes? Yes, and making everything possible. The next power is the power of positivity. And let me tell you, Milwaukee is a city positively on the right track and has been working diligently for years to implement community health workers within each neighborhood. Community health workers receive extensive training to care for their community beyond any one disease and attend to social needs, support the family unit, and offer strength-based approaches to build hope and self-esteem. By building a workforce from the inside out, the sense of purpose has been strengthened on multiple levels with diverse stakeholder involvement as they have advanced their vision and are now aligned with the Pathway Community Hub model. I love this hub model, and what it's about is a building of a care coordination infrastructure for communities to use resources more efficiently, effectively, address risk, improve outcomes, and align payment. The model, developed through the Rockville Institute, has over 20 pathways that measure risk and align the right coordination services at the right time and place. The hub is like air traffic control, linking care coordination agencies together and tracking pathways or outcomes across the community and/or region. Over time, they have gathered data which now supports the need for sustainable reimbursement and payments throughout the state of Ohio and other ACO partnerships. This model truly gives us hope for our pods and show us how the power of positivity can support one person at a time. While there's so much to learn from this case study that has greatly matured over a long period of time, fundamentally, I believe replication of their success begins with the following questions. How can purpose become the guiding light to healing? And how can the power of positive thinking build self-esteem across all neighborhoods? And ultimately, how can we build a workforce within each neighborhood that supports possibility? Moving on to the power of a self, AMADA is an organization committed to helping employers and health plans tackle chronic disease in the most engaging, effective, and scalable way. They offer a 16-week online digital health program that coordinates everything people at risk for chronic disease need to embrace lasting change. A full-time coach monitors progress and gives daily, around-the-clock feedback. Participants have smart technology delivered to doorstep and are matched with like-minded online peers for added encouragement and accountability. Through 16 weeks, participants are guided through physical, social, and psychological components of their condition. The key lessons learned here, I think, are how information, knowledge, and consistent use of data drives tangible feedback on progress. Coaches walk alongside and slowly behind each person as they successfully graduate from the program and maintain lasting connections to peers and friends. So our questions go right back to Diane again in her remarks about how can we coach and educate in small steps and encourage individuals in small steps that count to individuals. We also need to consider how, as we coach through those small steps, health literacy and knowledge become very important and central to impact accountability. And with this last question about caring through choices and options rather than through prescriptions and judgments, the emphasis is on choice, not limiting our minds of what each person can do, and help us realize that it is not the next prescription that is needed, but the power of care. The power of give and receive. Moving right along. The Share the Care program is a nonprofit organization with a mission to improve quality of life for anyone who needs support and to reduce the stress, depression, isolation, and economic hardship of their caregivers. Why? Caregiving is likely to touch everyone at some point, but people don't recognize it as a critical issue. 65 million people, or 29% of our population, are serving in this role. Share the Care is a grassroots guidebook born out of real-life experience of authors that have created a step-by-step format so others can pull their time and resources with a goal of creating a caring family. And uniquely, the Share the Care model provides information and suggestions on how to maintain this group's efforts over a long period of time. What I like best is the common bond and common ground that makes the group successful, and how these practices truly emulate the power of give and receive. Our questions with give and receive go right to the importance of pure relationships as being the difference maker, and how are family and strong relationships really the center of give and receive solutions, as you saw in Diane's story. And on a broader level, how can pods role model give and take solutions as they collaborate to find a common bond and a common ground? Moving on to one of our favorites as well, the GRACE model is an evidence-based model that really emulates the power of care. It was developed by the leadership at Dr. Stephen Council at the University of Indiana. GRACE team improves health and lives with care transition elements that support individuals with multiple chronic diseases. This support team is often anchored to primary care medical home to identify patients at high risk for hospital and/or nursing home placement. The GRACE team begins their work with a social worker and an APRN that conducts a home visit, gathering a comprehensive assessment from the medicine cabinet to the kitchen cabinet. Based on the findings, a larger multidisciplinary team, including a pharmacist, mental health worker, physician, create a care plan consistent with what matters most to the patient. The team is available 7 days per week for home visits and a phone call as needed by any individual, as well as the entire family unit. GRACE is proven to reduce costs by decreasing hospitalization and readmissions, delaying nursing home admissions, and reducing ED visits. In our review of the needs of New Haven, there is a great opportunity to increase home-based care coordination. Based on this need, we are excited to tell you that Leeway has decided to work with community partners to implement the GRACE model and to address the power of care. Hearing Diane's story, our first question with the power of care is how can we build that trust and compassion that she spoke to at every point of entry? And from the standpoint of caring for individuals at high risk in the home environment, how do we make sure we're removing that wall of fear that sometimes happens for individuals living in their home and build possibility? And how can we make ourselves available where people need us most, in homes, off hours, and on the weekends? Moving on to the power of collaboration, Camden Coalition and Hotspotters. In Camden, New Jersey, Dr. Jeffrey Brenner used billing records from the 3 main hospitals to create maps that tabulate ER visits and patient flow. His motivation was to answer the following questions. Can we lower medical costs by giving the neediest patients better care? Through hotspotting, or the practice of studying patient flow, what he found was that people cycling in and out of the hospital were usually receiving the worst care. Dr. Brennan worked diligently to use data to find expensive patients and then direct resources and brain power to them. But it was more than just brain power that was needed. It was a focus on developing real relationships with those in crisis and attending to crisis with unplanned visits and extended hours. And most importantly, the key takeaway was deepening commitment to those relationships and the responsiveness across multiple organizations. Through strength and collaboration referred to the Camden Coalition, the power of collaboration is a true time and investment worth taking, as you can see with the cost savings on the slide. As a community living model is built to target and provide better care for those with high cost and high need, the practices and lessons learned with hotspotting are relevant and underscore the compelling reason to create a system of pods. So what do we need to consider with creating a system of pods? Well, what are the breakdowns currently and the bottlenecks to the continuity? And how can we bring in people like Diane, community members that can really help us figure out the pods that she goes to, the go-to places that make her feel good, feel well, and already providing her with trust and compassion? And how can a true grassroots effort and collaboration support our sustainable change? The power of community, 2 powers left. So Santa Monica and their well-being project is very impressive. Santa Monica's well-being project is an initiative started and funded by the Bloomberg Initiative in 2014. The city has a history of innovative government policies such as housing and sustainability, and was the first to measure well-being and use data to improve the lives of its residents. While we want to acknowledge Data Haven and CARE that's done a comprehensive, excellent job of measuring the well-being in the city of New Haven, the key to reviewing this case study is exploring how Santa Monica used data and the process of engaging people in the solution. In the study, the most crucial step was the cohesive collaboration and effort of bringing together residents, organizations, and the local government working together to execute solutions. Together, they created their own definition of what well-being means in Santa Monica and implemented a consistent, rigorous focus on access and awareness of all well-being services and supports. With these questions, funny, when we talk to stakeholders about the power of community, often spirituality comes up and the great number of churches or houses of faith that exist in New Haven. So one bold question we have is, how can spirituality play a role and be a difference maker for disruptive change in community? The other question, through looking at the data at Davenhaven Report, is the impact of a clean and safe environment on positivity and on well-being. And finally, through No Wrong Door, how can New Haven be the model of how we access and make aware many of the services that are available and how our community thrives? And finally, the power of place. In this particular case study, we take away how zoos have undergone radical transformation in response to the current concerns of animals' psychological and social well-being. Dr. Stephen Bowden, biologists, suggest that environments need to fully satisfy both survival needs and well-being needs. I found this case study fascinating as we looked to creating a system where patients are not just living to survive, but to truly thrive. The key takeaway here is that healthy community environments can reduce the burden of chronic diseases, and buildings affect our psyche and as well as our bodies. Buildings can inspire and support activities of daily living, or they can deplete spirits and undermine the best of intentions. So with that goal of inspiring and not depleting spirits, of course, how can we address this first question? How can PODS and POW bring all people together and not separate or stigmatize by disease? We also ask this question in that we know that the ER is overutilized for complex care and primary care is often underutilized. How can the place of well-being, or POW, be a level in between? And finally, as Diane really addressed here and said, transportation would be less of an issue. How can transportation be less if we coordinate appointments under one roof, and when they're at their appointments, that there's opportunity for social connection, activity, and learning? And ultimately, we hope that the place of well-being is truly a place of healing, where just being there would feel healing. There's so much detail that we have covered in each case study, but there's so much more to learn, and we hope we've prompted inspiration for you to find out more. In the Living Storybook, you will find more details and the websites to access more information. We also hope you can see that the powers will be used to align practices and interventions and ultimately build the community model based on what matters most to the residents of New Haven. Next, these case studies, along with many local initiatives in place, will be brought to our visioning sessions and the process of co-creation. In fact, we've started an inventory of local initiatives aligned with the powers that we plan to leverage and support through this project. If you have a local or national case study that you'd like to share, please do contact us. And ultimately, we hope you will join us in this living story. So why don't we open it up, Delia, for questions?
Sure. If you have any questions, please feel free to type them in the chat box. We can see them here. And as we wait for those to come in, I know Heidi wants to thank a few people. How can we contact you? Good question. We will follow up after this webinar, and we will be sure to include contact information in that email. When we'll send you all the Living Storybook Chapter 2 later today, which we're very happy to share. You'll see our contact information there, and we have a slide up now so you can see our email addresses as well. Do we plan to have community health workers in New Haven as a part of this project?
Great question. We really have seen throughout, these case studies and what works in community, the need to make certain that we focus on the great concepts that brings, of bringing purpose to each community, as well as the true knowledge of each community needs and what each neighborhood needs to successfully thrive and to take care of one another. So we are excited to explore that with our community partners and throughout the pods, but absolutely, we believe in the philosophy, and we look forward to in our visioning sessions to talk to others about what that might mean for the city of New Haven.
And as we do so and have those conversations, we also have some really stellar students from a number of higher education, the universities here in New Haven, who are going to begin pounding the streets and knocking on doors in different neighborhoods to begin to develop a peer network, which isn't exactly the same as community health workers, but it is a first baby step. Thanks, John. Appreciate that. Thanks for bearing with us and your patience. There's a question about the visioning sessions. What will we be discussing in each of them?
Well, there is 5 different visioning sessions that will help us execute the overall development of the community living model. The first visioning session is the care management visioning session, which is actually next Wednesday. We cannot wait. Care managers will join us to look at the GRACE model, as we talked about, and to really make the GRACE model place-based so that we can ensure that we're not duplicating services, that we think about the handoffs and workflow, and we truly make certain that each component of the model makes sense to New Haven and to the stakeholders that are around the table. So that is coming first and will be in January 25th. So we're excited for that to happen. Next, we'll be gathering a group of individuals to begin to think about what does it mean to be a pod? Think about these guiding principles and powers we talked about today. Clearly, they've been developed through the voices of residents in the New Haven community. We want to make certain that we begin to test these powers and how they resonate with all the stakeholders we bring to the table. But ultimately, we hope the pods will talk about technology use, data analytics, the opportunities to train together, and the opportunities to build awareness together, and ultimately build a systematic approach to supporting individuals with high costs and high needs. The next visioning session, we'll move along to access and awareness, and that's what we'll be talking about the No Wrong Door initiative and how we increase service and supports through the state fund or the state program called the No Wrong Door. And you can access more information about No Wrong Door in our Living Storybook appendices. And then the next one is going to be on training and development, looking at how we can build a training program for individuals, for the organizational pods, and for the entire community that will propel all this work into action and motivate sustainable change and ultimately build an amazing community living model. And then finally, we're so excited, CAMA will be joining us. CAMA Inc. is an organization in New Haven that has really led the evidence-based healing design movement for healing environments, and CAMA Inc. will be joining us to lead the effort of designing the place of well-being. So, loaded question, I thank you for it. Certainly there's a lot more detail behind that in our Living Storybook, and if you're interested in being part of any of the vision sessions, please let us know.
And just to build on what Heidi just said about the timing, the pods and the access and awareness will most likely fall in February, as well as training and development in April and the POW in April. We do have a question about in which neighborhoods will we be piloting? And they're the same 6 neighborhoods that align with CARE's initiative, the 6 most impoverished neighborhoods in the city. They are listed in the Living Storybook as well as the timeline that I just mentioned. We have just a few more minutes, so if there are any more questions, send them through. In the meantime, I know I'd say something in closing.
Well, thank you, everyone. It's been a pleasure. And as I mentioned, I hope to have the opportunity to meet many of you, whether it's in person or over the phone, and answer questions that you might have. But before we end, I want to acknowledge Leeway's pioneering leadership, including the Executive Director, Heather Aaron, an amazing leader of Leeway, including the Chair of the Board of Directors, Mr. Dyson, and all the Board of members that have been so supportive, Dr. John Boos, Dr. Seidel, Dr. Sledge. I mean, there's just, the list goes on in terms of the board members, Melinda Schoen, that have been actively participating in this great work. And we're very excited to let you know that Leeway has hired their new program director for this project, Kimberly Turner Hugabook. More information and announcement will be coming out on Kim's role and her amazing expertise to lead this project. We're so excited. We also want to give thanks to our partners at DSS and the leadership of Don Lambert, Mairead Painter, and Paul Ford. We also deeply want to appreciate Liz Oshana, who has really put so much time and energy into the graphics. She is the person behind the beautiful Living Storybook and our webinar today, and she is from CAMA Inc. And last but not least, my deepest, deepest gratitude to the HPG team for the diligent commitment and passion for this work and this project. We know you all share this passion, and we really hope you will all join us in this Living Storybook.
Thank you much. Have a great day. Goodbye.